First of all, I would like to start with sympathising with the family of Eve Johnson and many more who have died in terrible circumstances. And I support this motion, as we have been highlighting serious concerns about the chronic overcrowding at University Hospital Limerick, UHL, for the last several years, and continuously this summer even, especially my colleague from Limerick, Deputy Richard O'Donoghue. The neglect by the Health Minister to this emergency has left many patients without necessary care, and some have died. Day after day, we witness delays in care for numerous elective patients as numbers spiral at UHL's emergency department, reaching an unacceptable level with 80,133 ED attendances in 2023, averaging 219 per day. UHL is the most overcrowded hospital in the country. This is not a new problem, yet no improvements are evident. This year, in fact, matters are worsening. We saw last week in the Cork-Kerry region where the National Ambulance Service tried to cut our ambulance services, but the Minister had to step in and get that decision reversed. Easy to know there is an election on the way. Would that have happened if there wasn't? That's the question. But the problem we have now, Minister, is where a lot of patients, obviously mainly elderly, who need long-term bed care, can't get bed carers in the community hospitals in my own constituency, and I heard another deputy speaking about it there earlier on, are in the nursing homes. They cannot get a bed. I have numerous people begging to come out, and their families begging, and have been told to take them out of the medical units of Bantry General Hospital and other hospitals, and they cannot get a nursing home bed, and they cannot get a community hospital bed, because we have not invested. Well, we've invested in improving them in the community hospitals. We have not invested in increasing the bed capacity in situations where an ageing population is rising. And we have a crisis situation. In West Cork, we lost Belgooly, and Deputy Healy Ray was praising a while ago. I'm sorry, we got no help with Belgooly, other than to get the patients out as fast as he could. It was like he hit them with a brush. To get them out into nursing homes, throw them anywhere. Didn't matter if there was a loved one next door to them. Didn't matter. You took it, or if you didn't, take them home. That was what they were told, and that was terrible. That was Belgooly. And now there's all sorts of rumours of where that building is going. 18 months later, that should have been taken over by the HSE. There's your opportunity. Would have been a fantastic investment and guaranteed beds for elderly people. The same with Bantry Nursing Home under the APRI situation. That's now in the hands of a very good receiver who is very good to the staff and is very good to the patients inside there, to the families of the patients inside there, and is doing his best to make sure that there's a home for these people, and it's going to be the same home as they ever had. But we have a crisis here that needs to be looked at deeper, Minister, and it hasn't been, and it has been neglected, and it's caused a major concern in my own area.
Thank you very much, Deputy Collins.